Hello, everybody, and welcome to this week's episode of the Press Playbook, where we bring on a different BAM team member each week to highlight some of the rad placements they're getting for their clients. This week, I am bringing on Briana, who is going to highlight the funding announcement they recently got their client XCaliber. Let's check out how they did it. Hello, Briana. So happy to have you on again. Thank you for coming on.
Hi, Kendall. Thank you. I'm always happy to be on.
So let's give a recap for folks who have not listened to some of your past episodes. Tell us what you do at BAM, your role, your focus, and all that.
Yes, so I am a senior account director here at BAM on our health tech practice. So what that means is I'm a senior level strategic and creative lead on our healthcare related business and partners. So I oversee about 8 different clients right now, working with a variety of the BAM team on media relations, creative thought leadership strategies, you name it, we're working on it on the healthcare practice.
So let's dive into XCaliber. I'm super interested in what they do, who they are. Tell us about them and how they fit into that healthcare sector.
Yes, so XCaliber is an agentic operating system that's been purpose built in the healthcare system to reduce administrative burden, cut millions in waste, improve the quality of clinical care delivered to patients, and overall just provide a seamless workflow for the healthcare industry. The easiest way to think of it is like what Tesla did for the automotive industry in terms of autonomous vehicles and autonomous driving. That is what XCaliber aims to do for healthcare. So it wants to have a platform that can run autonomously, but still have to be driven by human decision and have human in the loop who are controlling all of the end outputs.
That's so helpful and really, really interesting. So
Yeah, it definitely is.
And I feel like right now there is this health boom as well, where it's like everybody is so invested in their health and learning about their health and all of these different types of things that it's almost like patients are becoming just as educated as doctors, especially with ChatGPT. So I love seeing all the different ways that health tech is coming out and how it fits in and all that stuff.
Yeah, it's wild the amount of AI that's really saturated the healthcare industry right now on both the patient side, like ChatGPT, the Dr. Google, all the way to provider and health systems implementing it, like XCaliber, to really help with the clinical burden and administrative burden that comes with that as well, to be able to help the patients to have better care outcomes and be better with patients.
Totally. So tell us what was going on internally. We're highlighting the MobiHealthNews placement, which is very
Yes.
exciting for them. But what were the conversations going on? What was happening at XCaliber for you guys to go after that? Give us that background, and then we'll pull up the pitch and we can run through that.
Yeah, so this is a really exciting time for XCaliber. It was their first kind of coming to media, basically. They weren't in stealth, but this was the first time that we were really having a dedicated media push behind the company. And the reason why was that they had just raised their 6.5 million seed funding, which is a huge milestone and win for the company. So we engaged with them to help tell that story and to make sure that that story was told correctly amongst their target audience of those health systems and providers, and really just amplifying their voices within the industry.
That's huge and so exciting for them. That's
Yes.
very exciting. So let me pull up the pitch here. I'm going to make this full screen. So walk
Perfect.
us through this pitch, what you guys did well, why you put the things in here that you did, so we can get an understanding.
Yeah, so for background with this, we went out to Jessica Hagan at MobiHealthNews. We've worked with her in the past on several of the funding announcements. She does a really great job of distilling the larger funding moment into what it means for the industry, the impact it's going to have, and getting really granular in a way that the industry can better understand what the product is, the company is, and what their overall mission is. And so we reached out to her with this, knowing that HIMSS and MobiHealthNews was a key target for our campaign. We broke it out in a way that is easily digestible for her to see what the news moment is and what we're able to offer her within this story. So a little bit about the company, what they're going to be announcing, what that story is, what makes them different than others in this space, especially since this is an agentic platform. AI is somewhat of a buzzword nowadays across all industries. Healthcare is no different. So always want to include what their differentiator is, what their impact is. This is something that is key, especially within healthcare and AI related conversations. You can say that your technology is doing X, Y, and Z, but until you can say and showcase what that impact is, it may sometimes fall a little bit to the wayside. Especially in such a crowded space. So always included the impact and then the different spokespeople that we'd be able to offer. Not only do we want to have her talk with the CEO, but also wanted to offer the VC who led the round and a potential customer that they could speak to in case they wanted to understand more of that impact.
I love the format of this. I think it is so easy to see, so easy to look at.
Mm-hmm.
Nobody wants to read paragraphs. You want to know these things. And I love the addition of having a customer added as a spokesperson. I think that's huge. You don't see that a ton, and it eliminates the need to have to go back and forth. And it gives
exactly
that validation to the journalist, like, you can read all this, or you can talk to that one person and hear it there as well, which I love. This is a great.
Yeah, I definitely think impact, like data, statistics, outcome, all of that paired with the customer who can actually speak to their experience going through that process and getting that impact is always going to be huge.
And did you have a relationship with Jessica previously? I know up top, I think we got some other coverage from her.
Mm-hmm.
So that aided.
Yes, definitely aided. It's we've worked with her obviously on the Health Universe funding, but I've worked with her in the past too. She's a great reporter and one of the good ones within the healthcare space. So definitely recommend her stories and working with her if you can.
Well, we're so stoked for XCaliber. That was a huge placement. It's awesome for them to get that out. To close us out, Briana, tell us your one tip for founders who are looking to land press.
I would go back to the impact and customers. I think we're in a very exciting period right now with AI and all of the promises that it has and the work that it has been doing across all industries. Healthcare isn't exclusive in that, but I think it's a double-edged sword of, are we getting a little too saturated with AI can do this, AI can do that? It helps media a lot and readers. As a reader, it helps to understand what that outcome looks like. So being able to paint that picture for a reporter and showing even whatever data you can, if it's percentages of growth or time saved, money saved, having any sort of tangible outcome that you can point to goes a long way with media and helps have what you said to your point, that third person validation and showcases instead of just telling the reporter we do X, Y, and Z.
For sure. Well, Briana, thank you so much for coming on.
Thank you.
Uber team, we're stoked for them. And for everybody listening, we will be back soon with a new episode. Definitely go back and listen to Briana. She has had a ton of great placements highlighted. And Briana, thank you again.
Thank you, Kendall. Can't wait to be back.